Hi, how's it going? So our research question was on how does the relationship between social identity, coping, and mental well-being affect varsity athletes during the COVID-19 pandemic? So a quick explanation about our variables. Um, so for mental well-being, which we are trying to figure out how athletes perceive themselves emotionally, psychologically, and socially in the past 12 months amid the pandemic. For athletic identity, determines how strong an athlete identifies with being an athlete and how they are impacted and if they are able to compete. How strongly tied an athlete feels towards the team, along with how positive they feel about being part of the group, is the social identity. And social media coping is feelings towards using social media as coping mechanisms and why they use social media during the pandemic. So what we don't know is how these variables correlate together to affect mental well-being in varsity athletes here at UMW. So our prediction was collegiate athletes that have high levels of social identity and athletic identity, along with large usage of social media, will have greater mental well-being. So in our study, participants were college-age varsity athletes, 18 years or older, and on a current sports team here at UMW. And participants answered questions pertaining to mental well-being using the mental health continuum short form. Participants answered questions about their athletic identity using the athletic identity measurement scale. And participants answered questions pertaining to their social identity using the social identity scale for sport. Participants also answered questions concerning to their social media usage using a modified brief COPE scale. So for our results, the three predictors explain 3.7% of the variance, and the three predictors were athletic identity, social identity, and SMS. They were found not to be significant to the creaton variable of mental well-being. So some important findings in the future could be how do different cultural influences affect well-being, or long-term implications of the COVID-19 pandemic on mental well-being. With regards to our findings, this could have implications of social identity was correlated to athletic identity and understanding of UMW varsity athletes' mental well-being. Our survey was also limited to online for data collection, and the number of UMW athletes who took the survey because also have been some limitations in our study.